Have you ever been eating and suddenly felt something hard in your throat? It's a terrible feeling when it happens, but there is no need to panic. However, depending on what that object is, you may have a difficult time swallowing it or even breathing. That is why today we are going to find out what happens if you swallow a tooth. Hello everyone, welcome to our channel, the place where you can learn all about the human body. In this channel, we will be learning all about the body from head to toe, so make sure to stay tuned for more fun videos. Teeth are one of the hardest substances in the human body. That means that if you accidentally swallow a tooth, it may cause problems because it won't disintegrate like softer foods that we eat every day. Even though the teeth are the hardest substance in the body, they are not indestructible. The enamel on top is the hardest part of the tooth and is made up of minerals. Underneath that is dentin, which is softer than enamel. And inside the center of the tooth is pulp, which is made up of nerves and blood vessels. While swallowing food is an automatic process most of the time, there are times when you might have to make a conscious effort to swallow. For example, when you are very nervous or anxious, you may experience difficulty swallowing. This is called dysphagia. The good news is that this is usually temporary and goes away on its own. But sometimes dysphagia can be caused by an obstruction in the throat or esophagus. The most common causes of this are food or liquid that has gone down the wrong pipe or a tumor. Food stuck in your throat can cause dysphagia, but usually it will eventually pass. If the food is causing pain, nausea, and vomiting, then it is best to seek medical attention so they can remove the food from your throat. If the food or liquid goes down the wrong pipe, it can lead to aspiration pneumonia. This is where some of the aspirated material reaches the lungs and causes an infection. If you suspect that you have inhaled something, you should immediately seek medical attention. Even though your stomach acids are powerful, they aren't strong enough to dissolve a tooth. Stomach acid is between 1 and 2 pH units. The lower the pH level, the stronger the acid. A tooth has a pH of around 6. That means that stomach acid is only slightly stronger than a tooth. To dissolve a tooth, you would need an acid with a pH level of 0, that is 10 times stronger than the strongest acids found in the human body. While you do produce acids stronger than your stomach acid, those are only produced in very small quantities and are not strong enough to dissolve a tooth. If the tooth has been broken into smaller pieces, then it is likely that the sharp edges could irritate the lining of the stomach, leading to nausea and pain. If you swallow a tooth whole, it will most likely just pass through your digestive system without being broken down at all. If a tooth gets stuck in your throat, it could potentially block your windpipe and cause you to suffocate. This is a rare occurrence, but if it does happen, you must seek medical attention right away. Sometimes a tooth can get stuck in the throat and remain there for quite some time before it causes any trouble. The tooth may cause inflammation in the throat or esophagus, leading to difficulty swallowing. This is called dysphagia. If a tooth continues to move further down the throat and enters the stomach, it may cause an ulcer to form. An ulcer is a wound or lesion that can form in the lining of the stomach or intestines. Ulcers can cause a lot of pain and discomfort, and they can even bleed. If the tooth is sharp, it may cause a cut or abrasion in the stomach or intestines. This can lead to internal bleeding and other complications. Sometimes a swallowed tooth may cause an obstruction in the intestines. This is where the tooth gets stuck in the small or large intestine and blocks the passageway. An obstruction in the intestines can cause severe pain, vomiting, and constipation. It can also cause the intestines to twist or turn, which can reduce the blood flow to the area. This can cause the intestines to die and bacteria can start to grow. This is a serious complication called necrosis. Swallowing a tooth whole can also cause a perforation in the stomach or intestines. This is where a hole is made in the lining of the stomach or intestines. A perforation can cause bacteria and other contents of the stomach or intestines to leak out into the abdominal cavity. This can cause peritonitis, which is an inflammation of the lining of the abdominal cavity. Peritonitis can be life-threatening if it becomes generalized, meaning that it spreads throughout the entire abdominal cavity. The first step of the digestive process begins in the mouth where the teeth are located. When you swallow food, the tongue helps to push the food down, while the teeth help to grind it up. Once the food is ground up sufficiently, it is ready to go down the esophagus. After the food enters the esophagus, a series of muscles contract to help push the food down into the stomach. The food then enters the stomach, where gastric juices help to break it down further. The food then moves into the small intestines where nutrients are absorbed. Whatever's left over passes through the large intestines and is eliminated from the body. When you swallow, the epiglottis closes off your windpipe so that food doesn't go down the wrong pipe. Sometimes this doesn't work properly, and food can enter the trachea and wind up in the lungs. This is called aspiration. When food enters the trachea, it can cause coughing and choking. If the food makes it into the lungs, it can cause a lung infection called pneumonia. It is possible for a tooth to get stuck in your throat or esophagus. If this happens, you may experience difficulty swallowing or breathing. If you can't breathe, you should seek medical attention right away. If you can breathe, try drinking some water to help push the tooth down into your stomach. If this doesn't work, you may need to be treated with endoscopy. During endoscopy, a thin, flexible tube with a camera is inserted into the esophagus to locate the tooth. Then the tooth can be removed through the mouth or through the anus. There are many reasons why someone might swallow a tooth. You may have an eating disorder where you chew and swallow the tooth on purpose. It's also possible for a tooth to fall out and be accidentally swallowed, or for a filling to come loose and be swallowed. Children are more likely to swallow teeth since baby teeth are more loose and fall out easily. Adults are less likely to swallow teeth, but it can still happen. If you swallow a tooth that is still attached to the rest of the mouth, you may want to see a dentist before you swallow it. There are cases where people have swallowed their whole dentures. This can cause ulcers and other problems in the digestive tract. Dentures are typically made from plastic, metal, or a combination of both. These materials are not easily digested and can cause obstructions and other problems in the digestive tract. People who wear dentures are at risk for swallowing them, especially if they have dementia or another cognitive impairment. Even though we have learned what will happen if you swallow a tooth, you should still seek medical attention if you have done so. Only a medical professional can examine your throat and determine if the tooth is lodged somewhere it shouldn't be. They can also look inside your stomach to determine if the tooth has caused any damage. Depending on the situation, your doctor may recommend an endoscopy to retrieve the tooth. This is a procedure where a thin, flexible tube with a camera on the end is inserted into your throat. Your doctor will be able to see the images on a monitor and use the tube to retrieve the tooth. In some cases, your doctor may decide to leave the tooth alone if it is not causing any problems. In extremely rare cases, a swallowed tooth can travel to the brain and cause an abscess. This is where pus collects in the brain tissue and can cause an infection. A brain abscess is a serious medical condition that requires prompt treatment. Symptoms of a brain abscess include a fever, headache, nausea, vomiting, and confusion. Treatment for a brain abscess includes antibiotics and, in some cases, surgery to drain the abscess. So, what would happen if you swallowed a tooth? In general, swallowing a tooth whole would not cause any major problems. The tooth would pass through your digestive system without being broken down and would eventually be eliminated from your body. However, if the tooth was sharp, it could potentially cause some damage to your mouth, throat, or stomach. If you swallow a tooth that has been broken into smaller pieces, then it could cause an obstruction in your intestines. If you swallow a tooth that is still attached to the rest of the mouth, then it could potentially cause ulcers and other problems in your digestive tract. Now that you know what happens if you swallow a tooth, what do you think would happen if you swallowed a finger? Let us know your thoughts in the comments section below. Don't forget to like and subscribe so you never miss an awesome video. See you next time.